Heart failure is one of the most common admissions at the hospital, and many patients admitted for heart failure have a concomitant diagnosis of COPD. It is known that a metabolic alkalosis is induced when treating heart failure with diuretics. However, it has not been well defined as to what degree this metabolic alkalosis may potentially affect clinical outcomes in these patients. With this in mind, the objective and hypothesis of our own study were to assess whether there was a significant difference in bicarbonate levels of patients with and without concomitant diagnosis of COPD who are admitted for heart failure. And furthermore, we were going to assess whether there was any potential differences in clinical outcomes among these different patient populations. We performed a retrospective chart review in which all patients admitted to the Samaritan Hospital system with a diagnosis of acute CHF were further subdivided to those with and without a concomitant diagnosis of COPD. The primary outcomes which were measured included the bicarbonate level both at the time of admission and the time of discharge, as well as length of hospital stay, 30-day readmission rate, and 90-day mortality rate. Our sample size was ultimately 1,611 patients admitted for acute CHF, 235 of which had COPD and 1,376 which did not. As you can see in Table 1, the results of our study did show a statistically significant difference in the bicarbonate level of the COPD versus non-COPD populations, both at the time of admission and at the time of discharge. However, when looking at Table 2, there does not appear to be any significant difference in clinical outcomes in the COPD versus non-COPD patient populations. This included the 30-day readmission rate, 90-day mortality, and the average length of hospital stay. In conclusion, while there was no statistically significant difference in clinical outcomes, there was a notable difference in the bicarbonate level between the two patient populations. Furthermore, sub-analysis included a statistically significant difference in the prevalence of CKD among these patient populations, which may be a point of further interest. Further research with larger sample sizes may better elucidate differences in the clinical outcomes of these patient populations, as our sample size was relatively limited. This may be a point of consideration for future studies. Thank you for your time.